Hi, my name is Gretchen Kolhoff. I'm a respiratory therapist from the Dayton, Ohio area. I've been a therapist for a little over 32 years. I currently work in a large pulmonary practice. We normally see about 3,000 to 4,000 COPD patients a year, many of which are crossover with some resistant asthma. We currently have between 60 to 80 Alpha-1 patients that we're treating. As the respiratory therapy director, I have been educating and training all my new therapists about education and Alpha-1 screening, and I have been the one who has spearheaded our programs for testing. Typically, the patients would see between 2 and 3 physicians before diagnosis, seeing their primary care physician, possibly an internal med, and typically not found for Alpha-1 until they reach a pulmonologist's office. I've been practicing probably a little over 20 years before we found our first Alpha-1 patient. I was doing pulmonary function tests, and the patient was telling me how he used to be a swimmer, and he felt like he was out of shape and was trying to swim again, but he was not building the endurance that he felt he should be building over this time he's been swimming. He was swimming more and more, but he was still having shortness of breath. I asked him if he would mind taking a genetic test, and he said sure, and he was the first Alpha-1 patient that I found. COPD diagnosis cannot be considered a complete diagnosis without an Alpha-1 screening. With the new ATS guidelines and GOLD guidelines of testing for Alpha-1, that has encouraged us to adopt this process of screening for Alpha-1 during our pulmonary function testing. Most Alpha-1 patients are going to present as your typical COPDer. Many of them are going to have some shortness of breath, maybe some cough. Typically, your patient is going to present as a COPD or an asthma patient when they come into the office. To identify a patient with Alpha-1, unfortunately, you can't look at the patient or just look at their numbers, their typical blood tests that we do or their typical pulmonary function test. Being able to have a test that we can get a definitive diagnosis on makes our life so much more rewarding, that we're not just going on symptoms, but we actually have a true diagnosis with a definitive number or letter that we can say that this is truly what is the diagnosis. I recommend using the Alpha ID kit because it's free, fast, and accurate. It's a free kit test for our patients. It's a buccal swab or a finger stick, and it's a quick, definitive answer to define if the patient has Alpha-1. Screening for Alpha-1 is probably one of the easiest tests that we can do to get a definitive diagnosis for any respiratory disease available. Our practice is moving forward with the new process where we're going to be screening all of our new COPD patients who are having their pulmonary function test for the first time during their pulmonary function tests using a buccal swab. I would suggest that all practices choose an Alpha-1 champion to take this program and follow it from start to finish to get those patients tested and then follow those results so they can begin treatment as soon as possible. I would like to encourage all of respiratory therapists and healthcare providers to really start screening for Alpha-1. You're never going to find one unless you're screening. And the more we test, the more we're going to find.